So good day, my name is Maria Desir Alabuhan from DSN1G, and today I am going to perform a general survey. So the goal of this procedure is that the assessment is completed without causing anxiety or discomfort to the patient. An overall impression is formulated, the findings are documented, and appropriate referral is made to other healthcare professionals for further evaluation. So the first thing that we need to do is to perform hand hygiene and wear PPE if necessary to prevent the spread of microorganisms. Next is we have to identify the patient. So ma'am, can you please tell me your full name and the date of your birth?
Israel Simpa, and my birthday is on October 21, 2002.
Alright, so now that we have identified the patient, we will now close the curtains around the bed and the door to ensure client's privacy. And I will also explain the procedure to the patient to ease her anxiety. So ma'am, today I am going to perform a general survey on you. So this will help us understand your current health condition and address any problems that we may find. So do I have your permission to proceed, ma'am?
Yes.
Alright, thank you so much, ma'am. And do you have any questions before we proceed? Alright, so since we have the permission of the patient to proceed and the patient does not have any questions regarding the assessment, then I will now proceed with the assessment of the physical appearance of the patient. So the patient appears for stated age. The patient does not display any signs of discomfort, irritability, anxiety, and distress as well. And the patient's facial structure is round, erect, and symmetrical. So now I will assess for the client's mental status by asking her level of consciousness. So ma'am, can you please tell me the day today?
It's
Or date?
April 22, 2022.
Alright, and can you please tell me where we are today?
The house.
And can you please tell me the approximate time of the day?
Approximately it's 6 o'clock.
Alright, so the patient is alert and oriented to time, date, and place, and also the patient responds well with my questions. Next is I am going to assess the client's body structure. So ma'am, can you please stand for a while? So the patient's height is appropriate to her nationality and ethnicity as well as her age. The patient's weight is also proportionate to her height and body build. So the body fat of patient is evenly distributed and there is no abnormal growth of any body parts of the patient. So the body parts of the patient is equal bilaterally and proportionate. Okay, ma'am, you may now sit down. So next is I will assess for the patient's mobility. So first is I will measure for the gait of the patient. So ma'am, can you please stand and walk from here to the fan and back here again. So the patient's gait, as observed, is smooth, balanced, and well coordinated. Now, I will determine the patient's ability to perform range of motion exercises. Ma'am, can you please do flexion and extension of your neck? How about rotation? How about flexion and extension of your arms? Abduction and adduction. And then flexion and extension of each of your legs. And dorsiflexion and plantar flexion. And then dorsiflexion of the other foot, plantar flexion. Alright, so the patient does not display any signs of pain and discomfort on her facial expression while performing the range of motion exercises. So the patient can fully perform or move her joints. So this indicates that the condition of the patient's joint is good. So far I haven't observed any involuntary movements with the patient as well. So now ma'am, you may now sit down. So next is I will now assess for the patient's behavior. So far the patient's facial expression is appropriate to the current situation. The patient has a calm and relaxed facial expression. She does not display any signs of discomfort and anxiety as well as irritability. And the patient also maintains eye contact, and the patient's clothing or dress is appropriate to current climate. So the patient is free from any dirt and the wounds as well. So the patient appears well groomed and clean. So next is I will assess for the client's pain level. So ma'am, can you please rate your pain level from 0 to 10, with 0 having no pain and 10 having severe pain?
0.
Okay, let me just confirm that you did not feel any pain in any parts of your body, ma'am. Alright, so the patient does not complain any pain. So if in any case that the patient complains pain in a specific body part, then we have to proceed with the assessment with the cold spot. But since the patient does not have any pain, then I will now proceed with measuring the weight of the patient using an electronic weighing scale. So ma'am, can you please stand and let me just check if you have any pockets. Alright, so the patient does not have any pocket. So now, ma'am, can you please remove your slippers and stand straight in this weighing scale. Alright. Thank you, ma'am. So the measured weight of the patient is 65 kilograms. Now, I will proceed with measuring the height of the patient using a tape measure. So ma'am, can you please stand straight and maintain an erect posture? So, the measured height of the patient is 163 centimeters. So, now, ma'am, you may now sit down. So, now that I have the weight and height of the patient, I will now proceed with computing or calculating the body mass index of the patient. So, the body mass index or BMI, let us know the current health and nutritional status of the patient. So, I will just get a piece of paper. So, the BMI is computed by dividing the weight in kilograms over square height in meters. So, I have here a mini calculator to help me with solving the calculation. So, the computed BMI of the patient is 24.4, which is within the normal limits. So this means that the patient is not in the classification of underweight or overweight or obese. So now that I have completed the BMI, then I will now proceed with measuring the waist circumference of the patient. So ma'am, can you please stand again? And can you please breathe and exhale? So now that the patient exhaled, I will now wrap this tape measure around the patient's waist and align it to her umbilicus. So, the measured waistline of the patient is 36 inches. So, now that I'm done with the other assessment, then I will now proceed with taking the vital signs of the patient. So, now ma'am, can you please sit down here? So, the first thing that we will measure is the temperature of the patient using a thermometer. So I am using a digital thermometer and I am obtaining the temperature of the patient through her axilla. So I will just be cleaning the tip of the thermometer and make sure that the digital thermometer is in 0 reading. So while waiting for the temperature reading, then I will now proceed with counting the pulse rate of the patient. So I have here a phone for a stopwatch. Alright, so let me so the counted beats per minute of the patient is 36 for 30 seconds. Since the patient's beats per minute is normal and rhythm, then I will just multiply it by 2 to get the rate per minute. So the total beats per minute of the patient is 36 times 2, which is 72 beats per minute. And also, while my hands are still in place on the radial pulse of the patient, I also counted the cycles per minute or the respiratory rate of the patient. And for 30 seconds, I counted it 7 cycles per minute. So I will just multiply it by 2 to determine the rate per minute or the cycles per minute of the patient. So I have 14 cycles per minute, and this is within the normal rate. So now I will take out this thermometer. So the temperature reading that I have gotten is 37.4 degrees Celsius. So this is also within the normal limit. So let me just sanitize the thermometer. So this is a wet cotton gauze. So I am wiping this from the stem to the tip to avoid contamination. So lastly, I will now measure the blood pressure of the patient using a sphygmomanometer and stethoscope. Make sure that 2 fingers will fit inside the cup. So the blood pressure reading of the patient is 118 over 78. So this tells us that the blood pressure reading of the patient is also within the normal limits. So since I'm done, so thank you, ma'am, for your cooperation, and have a great day. So we must thank the patient for her cooperation, and after that, we have to remove any PPEs or gloves that we have worn, and then perform hand hygiene. And then we have to proceed with the measurement or assessment of specific body systems and document the findings and refer these findings to other healthcare professionals for further evaluation.